For many patients who sadly have failure of their organs, transplantation is really not only the best treatment available, but sadly is the only life-saving treatment that's available. Unfortunately, we simply do not have enough organs available for transplantation.
Every year, about 500 people die in the UK due to a lack of suitable organs available for transplantation. Donated organs can spend several hours outside the body without a blood or oxygen supply. This can cause damage that may make the organ unsuitable for transplantation. Researchers in the Department of Surgery are using animal models to understand the cellular mechanisms underlying this damage and to test promising new treatments that may change the future of organ transplantation.
One of the kind of specific goals of this project is to develop a novel therapy that will be really useful for our organ recipient patients in the future. The idea here is to be able to maximise the number of organs that are suitable for transplantation and therefore to ensure that the most patients are able to receive that life-saving therapy.
Development of new drugs or making discoveries about disease processes normally is a very difficult and lengthy process. It is important to use models, including animal models, that accurately capture what happens in the human body.
So the large animal models that we're using, that would be the pig model, are particularly important because the pigs match humans in terms of their size, their physiology, their anatomy, and therefore they're really important for bridging that gap between doing things on the bench side and in mice, and between trying to get a new therapy into humans.
We have a lot of data and years of evidence that actually the data that we can learn from animals can be essential for accelerating the process of making new discoveries.
In designing our experiments, we use the 3Rs principle as far as we can. So for example, in today's experiments with the pig, it has been designed specifically to answer multiple different questions in both the kidneys, in the heart, and also in the small intestine. And by doing this, what we can try and then achieve is to use as few animals as possible.
At all times, we try and replace animal use with other models. For example, we use organ perfusion technology where we are perfusing human organs with human blood, and then we are using that to test the safety and the effectiveness of drugs on these human organs. The idea that organs may be able to be perfused with blood outside of the body is not particularly new. The first serious attempt at doing this was almost a century ago, and this was done by Alexis Carrel and Charles Lindbergh, and they showed that various organs could be kept alive outside of the body for various times. Now we have more advanced technologies that allow us to reperfuse human organs with blood to first of all understand how organs function, which organs are suitable for transplantation, but also how we can perhaps improve the quality of the organs or reduce the damage that these organs suffer during transplantation. For the first time in the world, we were able to put human cells to regenerate or recondition human livers that previously would have been deemed untransplantable. So going forward, we hope that our dependency on animal experiments will reduce. But I think where we are would have been very difficult, if not impossible, to get to without animal experimentation.
So I'm particularly excited to be a part of this project. I think it's really important now that we're kind of on the cusp of understanding the real nuances of organ transplantation, and it's really exciting to be doing that in Cambridge, where we have all of these excellent clinical centres as well as the university departments. This is the kind of project that can't really be recapitulated elsewhere.
The sad matter is that actually there are patients dying every day today because we don't have an effective treatment. This research has the potential to save lives, and it's not just my research, but it's the research of people in my position. So this is why this is important to the society, because the people that we are treating is of course our mothers, fathers, sons, daughters and brothers and sisters.